Hello everyone. In this video, I'm going to talk about denial. Denial as a defense mechanism. I saw a patient, mid-50 woman with BMI about 50 plus. She refuses to get the blood test done. She refuses to get the weight checked. She refuses to get the vitals done. But she keeps coming every 2-3 months. We talk, and she's always in circular fashion and talking about other things, but she avoids talking about her obvious issues. And I think that she's in such a denial that I'm not able to help her, but I'm hoping that down the road, slowly, she will open to some discussion about her health. I don't even know why she keeps coming. I know that her son is my patient as well, so I've been helping him, and she does talk about him. But I do want to talk about her situation, but she usually deflects, and that's how the meeting ends every few months. So in psychology, there's a term called denial as a defense mechanism. And when it shows up in a medical setting, it can look like this. It's a subconscious defense when a person refuses to accept the reality of facts, because doing so would cause overwhelming anxiety, fear, and loss of control. And it protects the patient from emotional pain in short term, but blocks insight, treatment, and healthy adjustment in the long term. In medical issues, they would ignore or minimize their issues. They'll say, just that stress, it's not a big deal, I'm working on it. Don't worry about it, I'm working on it slowly. And in this patient, she kept telling me that most of her friends and family members have been telling her that, hey, you got to take care of yourself. You're not taking care of yourself. And she said, well, I'm taking care of myself. I'm working on it. But her main issue is eating poorly, and her obesity, morbid obesity. And she refuses to get labs done. I know she has a history of prediabetes that was years ago, and I suspect that she might also have undiagnosed, untreated sleep apnea. And this kind of patient also reject the seriousness of her diagnosis, because she kept saying that I feel fine. And in her mind, perhaps she's thinking the doctor is exaggerating. And they usually avoid discussion about certain diagnoses. For example, weight issues, she definitely doesn't want to talk about it, but she keeps coming every few months. And so one thing she agreed upon this time is that she's going to see a dietitian. Continue harmful habit despite evidence. So continue to eat unhealthy and having wishful thinking that things going to get better by itself. And there's a personality, they have a denial prone, coping style, optimistic, avoidant, and rigid personality that block out bad news. And But when advice does not pierce through, and rational explanation compete with emotional wall of fear, shame, or hopelessness. So patient feels in their subconscious mind safer rejecting the information rather than facing it. So my take on this is that I'm gonna be gentle, I'm gonna be persistent, and I'm gonna try to keep motivating her. Allow some time, maybe a few more visit, because forceful confrontation is really not gonna work. The fact that she keeps coming, that means she's open to some changes. And the fact that she listened to her friends and family that she got to take care of herself, and that she is trying to open it up, but she's fearful of finding out what's hiding in her body. Denial is not about not understanding. It's more about not being ready to accept what's going on. So, one interesting patient again today. Thank you for watching. I'll see you guys in the next video.